So the case study I've done in the past, but then this time I try to emphasize that if they could utilize a real patient case, if at all possible, which now they can't always do that, or sometimes it's a past case, but if they were able to, then they could take what they were learning in the class and actually apply it hopefully with that patient. So that was one piece. One piece is the critical thinking piece. They want sort of a cookbook approach to therapy or rehabilitation, and that's not how it works. You have sort of a set of guiding principles that you should always consider, and then you need to obviously adapt it to whatever the patient's needs are. Everybody's different, regardless if it's the same injury, the patient is different. The other piece the students struggle with a little bit is how what they see in the clinic they take as sort of the gospel truth. And again, there's just so many different ways to do things. And in the field right now, there's such a push for evidence-based practice. And as clinicians, you don't always have time to stay up with the recent evidence. But our students have that opportunity to dive into that and then analyze sort of what's happening in the clinic with and that patient's case with what they're learning in class and what they're reading in the literature, and then make an analysis. So I would do this differently, or I would do X, Y, and Z the same, but I would add in this. So it really gives them able to tie all those sort of pieces together.